The Marjorie E. Korff Parenting at a Challenging Time program is a parent guidance program. It's a unique program that we offer here at the Mass General Hospital Cancer Center. We provide psychoeducation to parents about how to support the needs and resilience of their children through the parents' cancer diagnosis, their treatment, and survivorship. We have a wonderful team of clinicians that collaborate together and work with families. We are child psychiatrists, child psychologists, and a social worker, each of us trained in child development and experienced with the common challenges that parents face when they're trying to parent well in the context of a cancer diagnosis and treatment.
We like to meet with families soon after a cancer diagnosis has been given. Because we feel as though having connection with one of our clinicians early on allows families to feel confident in communicating with children going forward from very early on. But there's really no wrong time to meet with us. So we meet with parents sometimes after a cancer recurrence, sometimes after a change in care, and sometimes even for some people at the end of life. So we're really happy to be consulted at any point in somebody's treatment here. We really work hard to collaborate with parents that we meet with, to think with them together about how best to support their children through the parent's illness and treatment here. So the goals of our meetings would be to understand from the parent's point of view something about the child's temperament and their development so far, and the kinds of concerns that a parent may have about their unique children. And then we really try to bring our experience and expertise to bear on that family's unique circumstances, and to think with parents about how to communicate with children, how to make sure that they're remaining on the developmental trajectory that they've been on all along, and how they can approach the illness with resilience.
The kinds of things that we end up talking about in our visits with parents, our meetings with parents, include what are the best ways to explain cancer to a child. For example, how would you talk about what cancer is to a 5-year-old or a 6-year-old? We'll think together with parents who may have particular worries about one of their children because of a past experience or because of a challenge that that child has, a developmental disorder, a learning challenge. And we'll try to think about not just what does it mean to communicate or what does it mean to be honest, but what might be the words to use. And also sometimes about timing. A parent may come to us during a time when they themselves are not sure what's coming next in terms of the best treatment for their particular cancer or their particular stage of cancer. And we may talk together about why might we want to talk about the cancer with a child early, or when might it make sense to wait until more information is in, bearing in mind that it's always hardest for a child if they get difficult news by overhearing it.
Appointment lengths vary in time, and we're lucky in that we can be pretty flexible about that. We meet with patients both in our outpatient offices in the Yawkey building, sometimes in the infusion unit itself as they're receiving a treatment, sometimes over on the inpatient side. So we're very flexible in where we can go, and that will sort of determine as well the length of the time we might sit and talk. We meet with parents as often as it makes sense from their perspective to have a conversation with us about their children. So sometimes that means that we meet with a family once or twice. There are other families that we may meet with several times across several weeks, and there are some families that we may meet with a few times and not hear from them again for many months or even years. And then as a behavior emerges with a child, or there's a change in the parent survivorship, they may come back to us at that time. The primary focus of our work is with parents. So we typically will meet with a parent who has cancer, or the parent who isn't living with the cancer, and whoever is co-parenting with them. Sometimes that's a husband and wife, sometimes it's a single parent, sometimes it may be a parent and a aunt or uncle or grandparent. It really is determined by who is in that important role
with the child. Primarily, we meet with parents or other caregivers, but time to time we will end up meeting with children and teenagers. And the reason that we meet with them is because together with a parent, we recognize that the parent will feel more confident in our guidance if they know that we've actually seen and spoken with their child.
Our service is free to anyone treated here at the Cancer Center, and we do not need to worry about insurance.